Late Night Health continues with Dr. Paul Corona. He's the author of Healing, the Mind and Body Trilogy, unlocking the secret truths about the mind-body connection. He's a regular contributor here at Late Night Health, and we welcome him from Laguna Niguel, California, a place that is close to heaven on earth. Santa Barbara, to me, is the other place that meets that criteria. Dr. Corona, we're going to talk today about the stigma of mental disease. People deny it. Now, if they have diabetes, they're proud to share it. I have diabetes, but my numbers were so good, I'm going to have that chocolate cake. I don't know why they do that, but they do. They shouldn't. But I hear that all the time. I have toenail fungus. I don't know why anybody would be proud of that, but they don't mind talking about it. But when it comes to a mental disorder, I can think of Epstein-Barr, chronic fatigue syndrome, depression, anxiety. People just clam up. They don't even want to talk about it to their physicians.
Yeah, that's one of the biggest issues I've seen in my practice over the years is the stigma issue of mental disease, because people have this notion that, doctor, is it mental or is it a real problem? In other words, I went to my doctor, I got all these blood tests, everything's normal, they can't find anything. So what's wrong with me? Because I don't feel good. And I tell them, they can only check things in the blood. When it comes to our nervous system, we can't do blood tests and check in the same way. So when people say, is it a mental problem, I ask them, well, what do you mean by mental? Do you mean the brain? And they go, well, I guess so. And I say, well, isn't that a pretty vital organ of the body? So I think it's just a perception of people that it's, but there's a lot of things. There's stigma, shame, embarrassment, guilt, a lot of things that go along with that.
Why is that? I mean, it's just part of life. Some people are going to have a problem and others aren't. Why is that stigma still there? I mean, it's going back to the Middle Ages when people who had anxiety or depression were literally put in prisons.
Right. And, our scientific advances in this field are vast and amazing, but the problem is the thinking is still outmoded, and we still think like our parents and grandparents about be tough and stop complaining and don't show signs of weakness, especially men. Men have a big issue with this because men perceive that it's a sign of weakness, of character. Women are a bit more open to getting help, but it's a stigma for everybody a lot of people out there. The vast majority of people don't get this.
And men in general don't go to doctors.
Correct.
I mean, they're not as apt to say, well, my arm hurts or my chest hurts or whatever, or I'm not thinking straight. They're not looking for some kind of professional help in general.
Absolutely.
And that's that man up syndrome that men have, that, be macho.
Right. And then also people get advice from family and friends and the internet, and they say, well, I only want to take supplements, I don't want to take medications. So people, there's so many misperceptions about what medications do, that there's a lot of people that just get advice from the wrong places, really.
Well, the stigma itself is something that medicines, either supplements or pharmaceuticals can't erase. I mean, we have to help change the perception of how and why people think of mental disorders inappropriately. Oh my God, are you nuts? I mean, that's from the Middle Ages.
Well, think about that. Are you nut? What are you, crazy? So people get labeled like this, and they come in. I don't think I'm crazy. I'm not really depressed. I'm just stressed out. Or so people don't like to say certain words like I call depression the D word. People don't like that word because people can relate more to stress and anxiety. But the whole thing is all related to the same subject of our nervous system and having proper balance there.
The understanding that you have cancer, that you have arthritis, is somehow different than knowing that I guess your brain is not operating at 100%. And let's face it, we're not Einstein. He said, what, we use 10% of our brain. Nobody uses 100%, and our brains are individual. To me, there is no normal. I mean, would you agree with that?
Well, again, the normal that we're looking for in an individual is what I'm hoping for is the healthiest normal and the healthiest self, which means when the person says to me, I got better energy now, I don't have pain all the time, I'm sleeping better, my sex drive is up, I'm not having the stress anymore. So the normal I'm looking for with my patients, again, in balance, is that state of self where they've maybe felt that way in the past, or maybe they've never felt that way. Maybe they've been feeling this way since childhood, and that's all they know.
How would they know then that they're, I'm going to use the word happy, because that's what you just described to me?
But happy is not, I'm not looking for with my patients a false, fake sense of happiness.
Because otherwise you could just hand them a drink. I mean, here, have a glass of whiskey.
And people misunderstand the medications I work with. I'm not talking about things like people know about benzos like Valium and Xanax and sleeping pills and uppers and downers. I'm talking about other types of medications that really actually get to the core problem of the nervous system and balance it. But you're absolutely right, and it's such a bad. There's nothing like mental disease, not even close in our society, that there's such a stigma about it. People don't have. There's not a stigma on cancer or diabetes or anything out there as much as neurochemical, and not just mental, but also you mentioned other things, but fibromyalgia, irritable bowel syndrome, chronic pain conditions. There's so many things I see over the years that are stress related, and if you think about stress. When people are under stress, things happen to their bodies. They hurt more. They can't. Their energy's down, in a variety of things.
And they don't work as well. They don't function as well within the family unit, or as I said, at work. Stress is really a 4-letter word. There's 5 letters. I know everybody. You don't have to write in, but it's something that we all have. And there's actually good stress, and there's bad stress. I mean. You know, bad stress could be an unhappy marriage, poor, working conditions. You don't like your job. You hate your job. Good stress is you're at an athletic competition and you want to win.
Good stress drives a person. Bad stress distracts the person. So that's a way of looking at it.
Do most people recognize the difference between good and bad stress?
Not usually, and see, when bad stress, basically when it causes dysfunction in life. In other words, bad stress causing distraction, low focus, pain that's distracting, headaches, can't sleep, all those things. That's bad stress, and that causes a lot of problems with functioning. Good stress can drive a person to succeed to a point, but as long as it doesn't go to the burnout stage.
And what about body pain? My neck hurts, my neck is stiff. Lower back pain is something that is, to me, very stress related.
Yes, and the most common things I see stress related symptoms are neck, shoulders, and upper back, headaches, jaw tension such as TMJ, lower back pain. Those muscle groups are probably the number one, and people can relate to when they get massages that the neck and the upper back is where they spend all their time, because that's where the stress builds up the most.
Are those beneficial, massage in that area?
Well, sure, but
I mean, it feels good at the time, but I'm sorry?
A lot of things can be beneficial. I mean, exercise is beneficial, massage, relaxation, yoga, all those things are extremely beneficial.
And they help reduce that stress. Is stress, would you say, right now in the 21st century, in the year 2015, is that probably the number one ailment that people come to you with, or not?
Yes, that is number one. People come in because most people don't come in my office and say I'm depressed, or I'm having a manic episode, or most people come in and say I'm stressed out. And I have to kind of unravel what's behind that, and And that's basically the number one thing I see in my office.
And what about depression? Would that be number two? Would that, and do they go hand in hand?
Well, they go hand in hand often, but some people get light on the depression, heavy on the anxiety, or heavy on the depression, light on the anxiety. So that's all, trying to weed all that out is what I do when I talk to people, to get to the core of the problem and get all the details.
We're going to have to talk at one point in the next few weeks about the difference between anxiety and depression. Our guest is Dr. Paul Corona. His patients call him Dr. Paul. He's the author of Healing, the Mind and Body Trilogy, Unlocking the Secret Truths About the Mind-Body Connection. We're talking about the stigma of mental disease, why people deny it. Now, I want you to think about this as you're listening. Do you know the difference in your own life between your good stress and your bad stress? And what do you do about it? Exercise, I've been told, is really the true fountain of life. You can go to a gym, you can pay a trainer, you can just simply walk. All of them work. It's all individual.
Absolutely, and that's a key thing I talk about every patient with is to look at their patterns, look at their habits, and look at their exercise, look at their diet. I look at all those factors to see what else we can do besides medications. There's a lot of other things we can do,
which we just mentioned, and then the medications that you prescribe for these. People don't walk out, they pop a pill, you hand them a glass of water, here, take this, and they walk out and they're giggling. It's not like that.
It's not a fake happiness, and if it's the fake happiness, I'm giving the wrong thing. But basically people get confused because they think an antidepressant, and they say, well, doctor, I'm not depressed, I'm stressed out. Well, we call this off-label usage of medications. I give antidepressants for anxiety, for pain, and certain ones are better than others for sure. And
everybody reacts to different drugs differently.
Right.
Do you use the drug therapy as a primary goal in helping a patient, or do you do a combination to fight that stress?
I use a combination because most people who are seeing me either have been to psychiatrists and family doctors and they are not understanding. So usually by the time they see me, they get referred to me. And so medications are often a part of my treatment, but also a combination with other holistic medications and therapies and psychotherapy, etc.
Well, Dr. Paul is the author of Healing, the Mind and Body Trilogy. We are unlocking the stigma of mental disease today on Late Night Health. We're going to take some time out, and when we come back, we will continue our conversation. In hour two, we're going to spend some time talking with Dr. Mindy Gentry, and we're going to talk about a new blood test, primarily for women, but it's for both men and women. It's called the Chorus CAD blood test. It actually unlocks a gene, or shows a gene that's unlocked to determine if you have coronary artery disease. Join us on LateNightHealth.com, LateNightHealth.com.